Hello, class. So we are going to talk about our first topic, which is what is public health. So I will start our first class today. So I'm going to share my screen with you first. So just wait for me. So we are going to talk about what is public health. And before we talking about this topic, let's watch a video about this topic. Okay? Yeah.
Before a child is born, a quest to ensure its long and healthy life begins. All over the world, public health programs work to improve the health and well-being of communities by identifying the risks that affect different people in different places at different stages of life and finding the best ways to minimize them. It's about giving everyone the best chance to lead long, healthy, fulfilling lives from the very beginning to the very end. A child dies every 3 seconds from infectious disease. But public health interventions can prevent this by promoting things like breastfeeding, immunization, and antibiotics. Where children die because they have no access to safe water or basic sanitation, public health programs can make water safe and conditions sanitary. Where research shows us who has the highest risk of developing certain conditions, public health applies it to the real world. It turns evidence into the advice and practical help we need to lead active, healthy lives away from danger. It helps us make the right choices and form the right habits that impact on our health now and long into the future. Poor health doesn't just cost lives, it costs money too. By preventing, detecting, and treating disease as effectively as we can, public health can help to halt the spiraling costs of treatment, saving lives and saving money. Public health is about understanding the huge impact that our financial, social, and environmental circumstances have on our health and reducing the differences between us to make us all healthier. It's about making health achievable in mind and body, at home and at work, by supporting individuals, families, and communities in the environments they live and work in. It's about working to ensure that no one is left out or left behind as we strive for better. Public health, preventing disease, prolonging life, promoting health for everyone at every stage of life.
Okay. So we just watched a video and talking about what is public health. So community health and public health is kind of same word, same like kind of a same language. So we can interchangeably can use both community health and public health. Okay, so public health. What is public health? In this from this video, what did you learn about public health? Can you summarize the public health with the three important keyword? What would be the three important keyword that represent public health? So actually, according to the definition of public health is actually the science and art of preventing disease and prolonging life and promoting health through the organized effort of societies and actions that society takes collectively to ensure that the condition where people can be healthy can occur. So from this video and from this definition, you can summarize, actually you can figure out 3 keywords that represent public health. That is population, community-based health. That means actually we actually promoting health for everyone, not individual. So public health actually work for everyone, not individual. Okay, yeah. That is the kind of differences from personal health. Personal health is kind of an effort to promote health for an individual, but the public health is kind of promoting health for everyone. Okay. So we take care of health for everyone, not only for individuals. And then definitely health promotion, promoting health. So we promoting health for everyone, right? Yes. And then the last keyword to represent this public health is preventions, preventing disease. Prevention means reducing risk factors, any attribute, characteristic exposed upon individuals that increase the likelihood of the developing disease or injuries. So you probably understand what is the meaning of preventions, right? So preventing disease means we actually make efforts not getting disease, right? Yeah. So it is not a different, it is kind of different from treatment, right? Treatment is actually after getting disease, we actually cure the disease, right? But preventing effort, preventions actually we make effort before getting this disease, right? Yeah, that is the prevention effort. So these keywords actually getting together, the public health is promoting disease, promoting health for everyone by preventions. So we want to promote health for everyone by preventing disease. That is actually the meaning of what is public health. So please keep in mind, we want to promote health for everyone, right? And by preventing disease, right? Yeah. Okay. Okay, so we are just to talk about what is public health, and then we are briefly talk about the benefit of public health. So if we do working on public health, probably as you can see, we can promote health, right? But also we can save money. As you can see in this graph, if we can prevent disease, we can actually save a lot of monies actually. So as you can see this graph here, like kind of if there is no risk factor or 2 risk factors, we actually expend $2,000. But as it increase more risk factor, we need to spend more money according to this graph, right? This study. So 3 or more, like kind of 3 or 4 risk factor, we need to spend more $1,000, about $1,000 more. If we have more than 5 risk factors, then we need to spend $3,000 more actually. So by working on public health, we can promote health, also we can save money, right? Yeah. So there are a lot of benefit to do this public health effort. Okay, yeah. And then the mission of public health is to improve the health of community, public, and achieve the equity in health status for all. So in order to promote health for everyone, so we actually try to achieve this concept, equity matters. So I'm going to talk about what is the real meaning of equity in public health, okay? In the next slide. So you guys can see two different photos in this slide, right? Yeah. One's equality and the other one equities. Can you see some differences in between these two photos? What did you find about equality? So equalities, we provide the same things. Here, we provide the same things to everyone, which is the one box, right? One wood box. So if we provide the same thing to all people, everyone, what is going to happen? Someone can watch the baseball, right? And someone cannot watch the baseball, right? But as you know, people have a different situation. Some people are rich and some people are not affordable for getting health insurance things or something like that. So everyone has different condition or situations about their health kind of related things, right? So if we provide the same thing, which is the equality, some people cannot access the healthcare, right? Healthcare service or healthcare like kind of a healthcare service, right? Yeah, cannot access. However, equities, depending on needs, we provide different things. So one box here and two boxes here and no box here. But what is going to happen? Everyone can watch the baseball. By providing different things based on needs, individuals' needs, actually, we can allow all people have an opportunity to watch this baseball. We actually have all people have the same opportunity to access the health care. So public health, in the previous slide we mentioned, the mission of public health is to achieve these equity matters by providing different things based on individuals' needs. So the key points, everyone's have same opportunity to access the health care. That is the differences between equality and equity matters. Does it make sense? So only works if everyone start from the same place, but equity indicate the fairness and making sure people get access to the same opportunity, right? Yeah. So that is the mission of public health. So how can we help all people achieve equity in health status? So we actually had many effort, tried to make many effort to achieve this equity for everyone. So what kind of things makes help all people achieve these equities? Here, public policy, public health education, public health system, changing environment. These things actually help all people achieve these equity matters. So let me take an example of this. Changing environment. So in this community, as you can see, this community, how about the being active? Do they have enough opportunity to be active in this community? There is no side work, and then there's no safe side work. So in this community, it looks like it's really hard to have the opportunity to access this like kind of be active, right? Yeah. But how about this community? Well organized side work, so well organized this environment, right? So in this community, all people had the same opportunity to be active. So some people who do not have money, not affordable to go to the gym, they probably going out the home and then work these awesome side work, right? So they can be still active. How about this community? If they are not affordable, some people are not affordable to go to the gym or like kind of go to some like kind of awesome like kind of facility, fitness facility. Probably they also do not have opportunity to work out outside in public like this. So this changing environment, public policy, this kind of effort allows us to achieve these equity matters. So we talk about what is public health today. Public health is to promote health for everyone by preventing disease, right? And then mission of public health is to achieve the equity matters, to promote and by preventing disease, right? Yeah. So in order to achieve these equity matters, we actually working on developing these public health like kind of policy or public health education and changing environment. This kind of effort allows us to achieve the equity matters, right? So please keep in mind this. And then our online assignments, I'm actually introduce our online assignment. For me. Okay, so our online assignment is here. Such public policy or public health campaign and public health education that have affect our health behavior. You can search only one public policy or public health campaign or public health educations, right? So, and then you actually introduce what you have found in terms of these questions, right? So what did you find and what was it about? What was the health impact? Why the health policy or campaign or education that you found would support the achievement of equity? And then you can make any comment on your answer too. Okay, so this is our chapter 1 assignment. Okay, yeah. Okay, so it is for our chapter 1 today, and then we can meet in the next class, chapter 2. Okay, yeah, thank you.